I look at like the more middle-aged individual that has knee pain, right? And they're
Mhm.
like, that's just part of my life. That's how my parents were. That's how my grandparents were.
I'm just
Uh,
getting older.
yeah,
I
yeah.
hate that statement. Hello, and welcome back to the Push Pause to Heal podcast. On this podcast, we explore health from the inside out, starting with foundations, connection, and the conditions that allow the body to heal. Today, I have a very special guest. Dr. Alex Springer is a doctor of physical therapy and a certified athletic trainer who specializes in helping people move better, prevent injuries, and address the root causes of pain. Sounds like a perfect guest for today. He has worked with everyone from recreational exercisers and runners to Olympians and professional athletes. Alex has realized through the years of working with a range of individuals that efficient baseline movement patterns are the foundation to preventing injury and optimizing health. Driven by a passion for empowering his patients, Alex works collaboratively with them to create personalized care plans that focus on reaching their full potential and achieving lasting results. So excited to have you here, Dr. Springer. Thanks for joining us.
Thank you, Dr. Emily. This is exciting. I've been looking forward to this. I can't wait.
Yeah, excellent, excellent. So, I've been thinking about this conversation, and I know you and I have talked about what would be important to share. And I think the conversation of feet around our foot health, I think, is so important because that speaking about foundation, like our feet are literally our foundation that we stand on day in and day out. So
Right.
I think, but most people don't really spend much time thinking about their feet until they hurt. So I would love to hear from you. Why are the feet and ankles, so mostly the feet here, so important to the overall movement and health of somebody?
Yeah, yeah. And I'm glad that you brought up that most people don't necessarily think about the foot or ankle much at all.
Mhm.
And, I'll allude to it later, but I think it's just because we have shoes that allow us to not necessarily have to think about it, right? If they're doing most of the work. But on the flip side of that, the foot is what we stand on all the time. It's what we walk on. That's what we go up and down stairs with. It's how we squat to pick things up off the ground, right? That's where everything starts. So when we think about the foundation and what that foot is telling us, is it's telling us a story from the start of the foundation, and that story then goes all the way up the body and tells everything else what's going on. So
Interesting.
that's definitely kind of should hopefully signal people to be like, wait, I should probably think about this because the rest of my body is reacting to how my foot's going to move. So
That's really interesting, and I don't think we generally do think that way, but it makes a lot of sense. It's like our first contact with the world in some ways. So Alex, can you tell us what can happen further up the chain, like the knees, the hips, and the low back when the feet aren't functioning well?
yes, yes, most definitely. When it comes to, we got to look at how the foot is moving primarily while walking, right? I mean, everyone is going to be, that's going to be their main activity throughout the day, hopefully. Hopefully, people are getting in a good number of steps throughout the
Yes.
day. Um, but for this, what we would like to see is that the foot contacts the ground, it hits the heel, and then you're able to roll through and push off closer towards the big toe. Okay. That would then allow the ankle to say, okay, we're moving in a more neutral, congruent fashion. The knees are then happier, the hips are happier, the low back is also happy too. But unfortunately, that's typically not the case. We know we're having some individuals that may walk and they just immediately roll to the inside throughout the whole entire gait pattern. Maybe they're more on the outside of their foot. Whatever way these patterns and these weight bearing patterns go throughout the soles of the feet, then could put increased stress into the knee. Commonly, I see the knee kind of caving in or rolling in, and you can only imagine, right? It's the additive. The knee's connected to the hip bone's connected to the low back, right?
Yeah,
So
yeah.
all these things are going to then translate to excessive stress to areas that just aren't needed.
Mhm.
So oftentimes, or I shouldn't say oftentimes, all the time, when I have someone coming in for knee pain, hip pain, low back pain, I'm going to say, okay, well, how is the foot interacting with the ground? Is that first part of your whole entire motion? Is it strong? Is it mobile? Because if not, then we're just kind of like, okay, you have knee pain. We'll chase the knee pain, but are we actually getting to what you're doing all the time on a daily basis? So,
Yeah. You kind of end up just trying to band-aid the other things and because you haven't really gotten to the root cause of the pain. So, yeah,
yeah, most
that's
definitely.
and I think that I've seen that actually personally in my life and my son when he was running cross country, that his knees were hurting because he had flat feet.
Hmm.
And I had like until we saw a physical therapist, I never knew that. We were looking at his knees. So yeah, that's very very true in my experience. Tell me, how do you think that modern footwear really has changed over time, and how has it changed the way our feet function?
Yeah. I would say, what I'm seeing more of a trend now so I should take this back. So when we're thinking about kind of what at least I look at with a shoe, I'm looking at how narrow it is, what the stack height is, so how high is the sole of the shoe, and then the heel to toe drop. So that's quite literally heel to toe, what that inclination is at the shoe. And I would say a good majority, not majority, but a good portion of shoe brands are starting to transition to have a more natural type foot shoe pattern. But but I should say back in the day, 20 to 30 years ago, I feel like it was more of a fashion tennis shoe. And it had that high stack height, high heel to toe drop, very narrow toe box. Okay, so you probably would see majority of your clients, majority of mine, that they take their shoe off and their toe box is like this. Okay, their toes are scrunched together, and unfortunately, that's just due to being in a shoe that you're developing your body in. You're going to adapt to whatever you're in, you know? So if that's how these shoes are, and most shoes are kind of still in that boat, then your foot's just going to form to that because that's what it's in all the time. So unfortunately, most shoes kind of put our foot in a position where it doesn't really have to work much because it's doing most of the work for it. And you're seeing more and more brands now that are realizing that, and you have some barefoot shoes, but you also have shoes that still have a somewhat of a style to them. They have some cushion to them, but they have a wider toe box. They're not so much heel to toe drop isn't so crazy significant. Um, so yeah, it unfortunately the shoe unfortunately molds how your foot's going to function because we're in them all the time, and that's just something to definitely consider with
Yeah,
footwear, with how
it's
you want to move.
I think it's true about so much of our modern life is like we've taken some of um, the struggle out of life, and we actually kind of need to struggle, right? Like the body is meant and built to have to do certain things and have to put some effort in. And when the shoe does it all for us, then the foot gets weak, that's very interesting. I know the listeners are dying to hear. Are there some brands that you recommend or things we can look out for when picking a shoe?
Yeah. So I think it really depends on the person and what their goals are, what their history is, with any sort of foot ailments or injuries, right? That's something to be mindful of because it's hard to kind of give this blanket, here's these two brands, and that
Sure.
works for everyone.
Yeah.
And I think it depends too on what their goals are. It could be someone that just wants to, this summer, they just want to play pickleball 2 or 3 times a week, or they want to go for
Right.
walks 2 or 3 times a week, or you have someone that's like gearing up for a marathon, right? So um, I think it truly does matter in that sense, but I would say an overall shoe that would seem to be a more compatible to just a natural foot pattern.
Hmm.
Brands like Ultras, Altra, they are have a wider toe box. Cushioning isn't too significant. They
Okay.
have variety, right? They have some trail shoes that are a little bit different. Um, and then when it comes to barefoot shoes, I wear Vivo barefoots. I wear those because uh, they're really good quality, but also if you're someone that still has a fashion forward type of sense, right? It does have a little fashion to it. I feel like some people feel
Okay.
they hear barefoot shoes and they're like, I'm not going to have five finger toes
Yeah,
shoes.
those are not attractive.
Yeah, right, right. So the Vivos I like, they have some really good styles there. And then, and like I said, it just depends. If you're someone that's really trying to train for something and you're going to be running a lot or jumping a lot or things like that, you know, go into something like a New Balance or even, you know, like the Nikes and the Adidas and things like that. Those aren't necessarily bad shoes, especially if you're someone that's brand new into training, just because your tissues and your body isn't going to be quite ready for that loading. So honestly, sometimes a more athletic shoe can help, but I always tell people if you're in that sort of shoe that is doing a lot of work for you, when you're not doing high impact activities at home, maybe try to be barefoot a little bit to give your body still some feedback of how it should
Okay.
be moving. Yeah.
That makes sense. Yeah, actually, that was going to be my next question is I would love to dive into the barefoot shoe conversation a little bit, but I was just thinking like when we're home, is it better to just take off our shoes and walk, be barefoot or in socks only?
Yeah, yeah, if you can tolerate it, most
Yeah.
definitely.
Okay.
I think it's a situation where I've had people that are like, okay, I could do that, but if I'm like standing and cooking dinner for a long time, or
Yeah.
if I'm doing chores all day at the house, like sometimes I need a little bit of support, and that's
Sure.
okay.
Yeah.
But I would definitely say if you could spend a good 70% of your household day, or time in your household barefoot,
Okay.
that'd be awesome.
Wow. Okay. Or even just a little bit more than what you've been doing, right? If 70% sounds like a lot to someone and you're,
Yeah.
currently, yeah, just a little bit more. A little bit more barefoot time is a win. But yeah, that
Yeah,
makes a lot of
right.
sense.
Yeah,
Yeah.
a little bit more would go a long way.
Yeah. And so let's talk about these barefoot shoes because they suddenly are, in the past couple years have become sort of trendy. And when something's trendy, you're like, okay, well, is there something really more to this, or is it just like a cool thing that people are doing? So tell us, I mean, it seems somewhat obvious, but tell us the benefits of a barefoot shoe. And is that something you kind of have to work towards? Because truthfully, like I'm not very comfortable in a barefoot shoe, so I sent mine back.
Yeah, yeah, yeah.
Yeah.
So yeah, I would say, it's an ideal shoe because it allows you to walk around during life when it comes to having a more natural foot pattern and how you move.
Mhm.
But with that being said, it's going to be challenging for an individual to be comfortable in them, especially if they have a number of years not in them. I think you get a realization of once you put them on of like, whoa, like my foot is feeling the ground. I have a lot of pressure in a lot of areas I didn't recognize before. So if you're someone that is truly wanting to explore that route, I always have people, well, first I'll look at their shoe and what they're walking in the present day
Mhm.
and seeing, are they walking in a shoe that's super high stack height? It's really cushiony. It has a whole bunch of stability added into it. If
Mhm.
that's the case, then probably not going to say, okay, tomorrow go buy your barefoot
Right.
shoes. It's going to be an instance where it's like, okay, let's try maybe something a little bit more minimal than that. Still
Yeah.
have some sole to it, still have a little bit of stability. And then we kind of work our way down the ladder.
The
And
baby
then
steps. Yeah.
baby steps, yep. And even when you get into your barefoot shoe, it's 15, 20 minutes in a day. And then
Yeah.
put your other shoes back on,
Yeah.
right? Because it
Yeah.
it's a pretty big shock to the system,
Sure.
to be wearing the barefoots. So
Yeah.
at the end of the day, it does allow you to move and have that barefoot feel and create some strength throughout your whole entire lower leg. I know
Mhm.
when I first started wearing barefoots, it was like, wow, my hamstrings are sore, my quads are sore, like just from walking.
Things that
But
didn't have to work before is what you're saying.
correct,
Yeah.
correct, right? Yeah, you start to realize, wow, the shoe is doing this for me,
Yeah.
but in the same breath, there's a progression to it.
Yeah. Wow.
Yeah.
Great conversation. So, how can someone tell if their feet and ankles are prepared for the exercise that they're asking them to do?
Yeah. So that's where a general assessment would be awesome, to
Okay.
see how the individual's moving from foot and ankle even into like pelvis, hip.
Hmm.
as well. But yeah, you want to have an adequate amount of range of motion at the ankle. So there's numbers to these to kind of know,
Okay.
okay, am I ready for this? Because you want to see ankle mobility and how the foot moves because like I said, the shoes they were in prior probably has limited that because they haven't had to really manage that range of motion. So do they have the range of motion to be able to fit into a barefoot shoe that's going to demand that of their body?
Hmm.
And then also there's things like some balance testing, some calf strength testing, and just to see how can your body react to being barefoot and does it have the capacity to now be the primary mover instead of your shoe being the primary mover.
Yeah, yeah. So it really would benefit, especially if you're taking on a new something new in your day-to-day life. Like pickleball is quite popular, if you're looking
Hmm.
to do that more and do it without being injured, maybe having an assessment to see like how is the body, are you ready for those types of movements? What shoe would be the best option for
Hmm.
you in doing those things, and the balance aspect too.
Yeah. Oh, most definitely. Yeah. I mean, if anything, you're going to learn a lot from that assessment.
Yeah, yeah.
Sometimes I have people, they're like, well, did I get better? And I'm like, well, you learned a lot and you were able to figure out that, you have some deficits. So those
Yeah.
are going to be things to work on.
Yeah.
So,
I mean, I think that knowledge is power. Then you have, yeah, even if you spend 2 minutes a day thinking about your feet that you didn't before in, a new way and strengthening them or whatever, that's going to help us. Because, most of my listeners, I think, are, we're people similar to myself. We're at an age where we really are trying to stay active, walking or hiking or pickleball, strength training. And but we're also a little bit more prone to injury than we used to be. Like you can't get away with stuff quite as easily as before. So sounds like an assessment would be a good point to help stay active at maybe more into midlife and without injury. um,
mhm.
and we know
Yeah.
activity is
Um,
what's going to
yeah.
keep us
Most,
healthy, right? uh,
yes, yes, right. And I'm always going, like, I'm never not going to encourage people to be active, but yeah, it's going to be an assessment of where you want to be. It's kind of like, how do you want to move in a few years, and what do we got to do now to make sure you can maintain that?
Yeah, yeah. I think it's so critical. Because the thing that happens, or I've seen happen, especially in my primary care days, but also now, is if there's an injury or something even like plantar fasciitis, and it sort of takes you out for a while, that is a really slippery slope, right? I'm sure you see it, but like you start becoming sedentary, then everything starts to get weaker, and then you really can lose a lot of strength, mobility that you had. Just if there is an injury, we want to recover and get back in it as quickly as possible. So, um, yeah, I don't know if you have anything to add to that, but I think staying active through all of it is my take home message. I don't know.
Yeah, yeah, and I'm glad you brought up plantar fasciitis because yeah, that is a stubborn injury to get rid of and to combat. But it is also one that like you mentioned, you do have to kind of keep moving, right? You have to continue stressing the tissue so it can adapt, but you have to be kind of smart about that, right?
Mm-hmm.
So that's the one thing that I really hone in on if someone's coming in with Achilles tendonitis, plantar fasciitis, some sort of soft tissue injury of that nature.
Mm-hmm.
It's not, I need to be in a walking boot for the next 4 weeks. It's okay, how do we manage your stress at a tolerable level so you can adapt, but not cross the line of having significant pain on a day-to-day basis?
Yeah, yeah, that's a place where I think we could all use some support from a physical therapist like yourself. Yeah,
Mhm.
it's these are critical conversations to have because I think we assume all pain is bad. So anything that's hurting us, oh, I can't do that, right? Which is I mean, your body's talking to you, so we want to listen. But
Yeah.
there's a way to be smart about it, is what you're saying, which I love.
Yeah, yeah, I'm always going to tell people when it comes to pain, listen to it. But yeah, it's just your body saying, hey, something's moving weird here, something's a
Yeah,
little off, and we got to figure it out.
yeah.
So,
Besides pain, are there any other warning signs that you see that the listener could consider that maybe the body is compensating during exercise in a way that isn't optimal?
Yeah, definitely. I would say a lot of the times what I see is people like when it comes to simple things like picking things up from the ground, going up and down stairs, if you feel like it's hard for you to squat down to even get the motion to pick things up off the ground, right? That's going to then lead to a lot of hunching at the back. Then we run into low back pain. But that could be that most commonly that comes from poor ankle mobility. Or you're going up and down stairs and you have to kind of walk with a stiff leg down, or you notice that you have a lot of knee pain going up the stairs. Um, you, I think what I really find is people don't realize that they have movement compensations until I point them out.
Mm.
But those sorts of things aren't necessarily normal or should be part of your life. You right? Individuals
Mm-hmm.
should be able to navigate stairs, pick things up off the ground, these sorts of things without pain. So more, I would say more often than not, compensations are occurring. We have to figure out what those are and how to address them.
Okay, we had a little internet glitch, so we're back, and I thanks again, Alex. And let's talk about, one thing that I love is the that physical therapy and functional medicine really share that root cause philosophy. So I wonder if you could talk about that and how you see that in your work.
Yeah, definitely. And definitely going into functional medicine and where kind of found that connection in physical therapy and why I kind of wanted to started my own clinic in physical therapy
Yeah.
was, the more and more I looked into and read about and listened to podcasts on functional medicine, I thought to myself, wait, that's what physical therapy is, right? We're trying to figure out what the root cause of this injury is, right? How are you moving on a daily basis? What are you doing throughout your life? What are your habits that are creating the pain or issues that you're dealing with? It's like kind of what we talked in the beginning. It's like, hey, I have knee pain. All right, but let's see how your hip moves. Let's see how your ankle moves. It may even be coming from the spine, right? And
Yeah.
when it comes to functional medicine, it's they're taking that full picture approach. Can we really figure out where this root cause is? And that's what I always tell people when they come in too, right? Sometimes people are like, my ankle hurts. Why the heck are you looking at my low back? And it's just a situation where we have to figure out what is the base of what we're working off of so that way we can rebuild, we can start to create some habits, even if they're small habits, to be able to make a difference.
I
So,
love that. Yeah. I mean, habits are just so critical to, we all have habits. We're doing things every day that we do all the time, right? And,
mhm.
are they serving us or are they hurting us, right? So having those good habits or switching a habit that maybe wasn't optimal, even switching it a little bit can have a huge payoff because these are things we're doing day in and day out, like with our feet. Like literally, how many steps do people take? Hopefully, closer to 10,000 a day. That's a lot of repetition that
Mhm.
of something that if we're not doing it properly, can really cause a big issue. So yeah, I love that overlap, and I think so. Tell us, so that was sort of your journey was maybe leaving the traditional physical therapy model a little bit, or I don't know. I'll let you kind of tell us how that came to be.
Yeah, definitely. Background is in athletic training. That's where I started with things. And from there, kind of said, hey, I want to be a little bit more specialized and focused. I do really appreciate and I'm curious about the rehab setting. So went into the traditional outpatient orthopedic world. And, it's one of those situations where you get to treat people and you definitely you get to make a difference in people's lives, which is awesome. But you're kind of limited on what you can truly kind of explore and do in that world. So came to that realization and was like, wait, I want to have the opportunity where someone walks in my door and we can have a relaxed conversation of what's going on. Now we have the time to then say, let's look at this, let's look at that. How do these things correlate and work together? And then how can we create that plan that's more individualized to you to allow for you to feel confident with yourself and on a day-to-day basis creating better habits.
Yeah,
So
I love that.
that's the basis of it.
Yeah, that's great. And I think you and I are so similar in that way because we were stuck in a system where we couldn't actually have the impact that we wanted to be able to have due to time constraints. And I think, the insurance world has just so many concerns and issues this at this stage. And to be able to actually work on prevention of disease and promotion of health rather than just like, oh, let's band-aid this little problem over here and band-aid this little problem. Like, I think we were ready for something a little more, right?
Yes.
Yeah.
Yeah.
And I think that's what our listeners are here for sure as well. So I appreciate that. Let's talk about, one of the things that I see that I just would like, it's a pattern I'd love to interrupt a little bit is something starts to hurt, a knee hurts, you hurt your back, or, you threw out your shoulder or something. And kind of the knee jerk response is, oh, I need to go to the orthopedic doctor. I need to see that specialist. And so can you tell us like maybe why someone shouldn't automatically jump to an orthopedic referral, imaging, injections, and all of that world and how you would see that progression happening? I know my 2 cents on it, but I'd love to hear from you.
Yeah, yeah. So I think it's good to start off with having people understand that physical therapists are very highly trained when it comes to evaluating orthopedic ailments. So hopefully that instills a little bit of confidence to come to a physical therapist directly. And if they have, like, if they're like, oh, this is kind of a nagging pain, like, we're more than capable to, take a look at things. But I would say for the most part, if you have some sort of pain, wherever it may be within the musculoskeletal system, within bones or muscles, whatnot, majority of the time, coming to a physical therapist will eliminate the chain of events of, okay, now we have to do imaging. Let's take a couple weeks off. Is it better? No. Let's do an injection. Is that better? No. Let's do an MRI, So if I would say the situations that I tell people, if you have an injury that's due to a traumatic event, okay, if you have a ton of swelling at a joint, lots and lots of pain, you can barely move that joint, or because your low back hurts so bad you can't get out of bed, yes, okay, maybe that's an instance where we're gonna, at least I would even say, hey, let's send you to at least your family doctor to get the ball
Sure.
rolling.
Yeah.
You
Maybe
know,
some x-rays or something.
Right.
Yeah.
But like I said, majority of the time, especially with those individuals that aren't in like an impact sport or, a sport where you can have those sudden traumatic injuries,
Yeah.
majority of the time, let's see what's going on in the system,
Yeah.
and the system being your body, and let's attack a few things first before we throw you into the chain of events of
Yeah.
the traditional medical model.
Yeah, it does seem to just keep progressing down that path once you get started. And there's a lot of surgical procedures that are done that we're not really sure are necessary, especially for around back issues. The data on back surgery is just really, it shows us it's not generally helpful. And
Mhm.
yeah, I would love to Alex gave us great understanding of when we really need to go see a doctor first. But most of the time, for the general day-to-day life, like, oh, this has been bothering me, seeing a physical therapist like Dr. Springer would be a really good first step and may just cut off the need for anything else, save you lots of money, and help you get stronger and function better in a lot of ways moving forward so that thing doesn't happen again.
Yeah.
Yeah.
I'm glad you alluded to the outcomes too, because pretty much no matter the body part,
Mhm.
unless it's truly significant injury, your outcomes are going to be the same, if not better, as what they've seen physical therapy compared to a traditional
Yeah.
plan of care.
That's
So
wild. Yeah. And I think it also comes back to, which I think you and I would be in total agreement on this, like your body has a lot of capacity to heal. And so if you can work with Dr. Springer or someone, a physical therapist in your area, and get the things in alignment or strengthened that were weak, then your body's like, oh, I got this. Like I just needed some guidance. I just needed a little tweak. So didn't really need surgery in the long run most of the time. Yeah.
Yes. Oh my gosh. Yeah. 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 I couldn't agree more with that.
So tell us, are there some certain types of issues that you see commonly improve with physical therapy that our listener might be surprised by?
Yeah. Yeah, definitely. I would say when it comes to honestly, like plantar fasciitis, like we brought up,
Okay.
right?
Yeah. Yeah.
People
Super
think they
common.
just need to stretch and they need to stretch and they need to keep stretching, you know? Um, uh, there's so many. I guess when it comes to if I'm thinking about the knee, I look at like the more middle-aged individual that has knee pain, right?
Mhm.
And they're
Mhm.
like, that's just part of my life. That's how my parents were. That's how my grandparents were.
I'm just
Um,
getting older.
yeah,
I
yeah.
hate that statement.
And they're like, they do 4 to 6 weeks of targeted mobility and strength work, and they can move better. And they're like, wait, this pain actually isn't as much as it used to be. So those sorts of things I feel like really catch people by surprise.
Yeah.
They're like, oh, this isn't just part of me getting older and my wear and tear, and
Yes. Yes.
you just have to move your body a little bit better and see if that improves it.
That's amazing. Yeah. Getting older doesn't have to suck. Like, give it a try and feel better. I love that. Yeah.
Mhm.
And if someone wanted to invest in their future mobility today, so as my parents are aging, and I think a lot of our listeners are maybe witnessing aging parents or loved ones, and seeing kind of a path that they don't want to go down. If I want to stay really mobile for the future for my long haul, where would you tell me to? Where would that person start?
Yeah. So I would say to that person, can you get into typical day-to-day positions without worry or without aches or pains, right? Can you kneel down onto the ground? Can you get up off of that position? Okay. Can you move side to side, right? Can you rotate well through your low back and through your hips? Um, People like to go in a straight line. They like to walk straight ahead. They like to sit down. They like to stand up. Okay. And it's a matter of find moments where you have to move side to side, where you have to get on the ground and kneel down and then get up out of that position, right? Give some variety to your day to day. I just think is a great starting point to think about.
I love that.
Um, because you'll find that you're like, I have people that are like, oh, I don't know if I could do that. I haven't done that in a while. And I'm like, well, that's what we're intended to do. So,
Yeah, yeah. Yeah, those functional movements. That's what you're talking about, really, the
right.
things that we do need to be able to do in life and are going to keep us safe from falls and other things. And yeah, because I think one of the biggest concerns with people is like being able to get up without like using your arms to get out of the off the chair, or it becomes really important for staying, your ability to stay continent for the rest of your life. Can you get up and down off the toilet by yourself? Like we don't want to lose all of those
Mhm.
different functional movements. So we want those things we do in life to be easy enough when without restriction, and then also maybe challenging ourselves, like you're saying, that the movements we don't typically do, is balance. I would think would be really critical, and that's really starting in our foot. Is that a fair statement? And maybe you have some thoughts around being better with our balance.
Yeah, yeah. So starts with the foot, most definitely. But when you expose your body to a three-dimensional plane of motion, rotation, side to side movement, moving forward and back, you're telling your body different positions it should be in, and that together creates greater proprioception, which is balance, which is your body's awareness of where it is in space. So yes, getting the foot stronger, more mobile, movement variety, right? These are things your body wants because it's telling the system that, hey, we can still balance in all three planes of motion, which we should be able to tolerate. And without having these, I mean, even without having a tailored, focused treatment plan, that's going to prevent your falls because you're just challenging your body throughout your daily life, instead of just doing the same old.
Yeah.
Um, and I would say the thing that, you mentioned, like, don't love it when people are like, it's part of getting old. My thing is, I don't do that in motion anymore because it causes pain.
Yeah. Okay. Okay.
Um, well, it's like, well, I think you still need to move that way, right? I think the body still needs that. Your joints are meant to move in that direction, right? So you're avoiding a stimulus that your body needs to
Interesting.
have longevity in life. So,
I love that. Yeah. And then it just would get weaker and weaker and harder to do that.
correct,
Yeah. Yeah.
correct.
Do you have, I'm kind of putting you on the spot here, but can you think of like two, three little, tiny little things that we could do during the day? Like I'm thinking, while I brush my teeth, should I be standing on one foot, or something along those lines? Little tiny things that we can be doing to incorporate either balance or those movements that we tend to avoid naturally.
Yeah, definitely. So standing on one foot is a great test, and there is some nuance to it.
Okay.
But it's just a matter of, can I stand on one foot barefoot with my heel, the ball of my pinky toe, the ball of my big toe touching the
Hmm.
ground,
Okay.
and can I keep my pelvis level, my waistline level? Can I keep my shoulders level? Hands on hips, and just maintain that position. Okay.
Okay.
That gives your already. Are we wobbling a little bit? Are
Yeah.
we
I
grabbing on the
think I am.
toes? You're
I'm,
just thinking about
I'm
it
envisioning.
right now. Are you using your toes a lot to grab the
Mm,
ground, right? Like these are just your body telling you, hey, our system isn't in balance like it should be. Let's work on
mhm.
this. And I would say too, if you're sitting up and standing from a chair a lot, that's awesome. But if not, do like 5 reps of just sitting down, standing up, sitting down, standing up, okay?
Okay.
Without
Yeah.
using your hands.
Yeah.
Give the legs some stimulus, get the knees moving a little bit.
Okay.
And honestly, too, what I like to have people do to kind of wake up that foot and ankle to kind of get things moving is slow forward, heel to toe pattern, barefoot. As slow as you can tolerate,
Just pay
heel,
attention.
feel the big
Yeah.
toe come off the ground. Even just simply walking side to side, barefoot too, right? Just
Yeah.
give some different stimulus to your body that it isn't used to is a huge, huge factor.
Yeah, when you were talking about side to side, I'm thinking, well, there's this kind of little alley in my kitchen that I go through a lot to go, from one end to the other. Maybe I'll try to start, like I'll go get the cutting board, I'll walk sideways and go get the cutting board and come
Yeah,
back
yeah.
over to this, to the stove. And it's those little things. Like it really is remarkably, it seems so simple, almost silly, but it's those little tiny things. If you can just do them a moment here, a moment there,
hmm
the body responds, right? It gets stronger and it gets easier for the next time. So
Yeah,
that's awesome.
the body's craving movement stimulus.
Mm. Oh,
So
that's a great one. The body's craving movement stimulus. I love that. I love that.
yeah.
That's a good takeaway. Um, okay, so and I think I just wanted to see if there's any last thoughts that you have. Like I'm thinking, anything you would want our listener to think of that maybe has been misunderstood about movement or pain or staying active. Anything we haven't discussed yet that you want to make sure to tell us about, or do you feel like we've covered everything?
I think, like I mentioned before, I'm going to always encourage people to move, and I think sometimes people have it's a very that word is movement is it varies amongst everyone, right? They're like, I'm not going to go out and run 30 minutes a day. Well, that's not necessarily what I'm asking you to do, right?
Yeah.
Um, where can we figure out a point of movement that is comfortable for you, is going to give you some progress? Because I know exercise is always part of the prescription, no matter kind of what you're dealing with, right? So um, we have to figure out a way to get you moving, to keep you moving, because you have pain with certain movements doesn't mean there's a way around it or there's a way to get you feeling better, right? I mean, I saw a study recently that was 4,000 steps in a day decreases your all-cause mortality, right?
That's
So
wild.
it's just like that's really not a ton, you know. I think people think of I'm not going to walk 10,000 steps a day. Well, you don't necessarily need to, right? And then in that study, they showed every 1,000 steps after that decreased it by 15 more percent, right? So it's like, you know, it doesn't have to be these challenging, hard tasks that we see on social media. Um,
Yeah.
just start to add a little bit more to your day.
I love it. I have a saying that sleep is the cheapest medicine out there, but movement might be right up there with it. Like an extra 1,000 steps saves you that much in all cause mortality. That's pretty impressive. Yeah.
Yeah,
Yeah.
yeah.
And we take it for granted, I think, you know.
Oh, definitely.
Yeah.
Yeah.
Well, thank you so much. This has been just an amazing conversation. Dr. Springer, can you tell us like where, so you're located, your office is in the Columbus area. Tell the listener if they wanted to connect with you, like
Mhm.
what's, you know, how do they reach out, or are you on social media? Like how can people follow you and find you?
Yeah, definitely. So social media wise, I would say that my biggest platform is Instagram.
Okay.
It's human efficiency underscore DPT. Our website is humanefficiencypt.com. Can contact me through that route,
Okay.
or just shoot me an email at alexspringer@humanefficiencypt.com.
Okay.
Even message me on Instagram. It doesn't matter to me.
Okay. Okay.
I'll look at everything and make
Great.
sure I stay in contact and answer any and
Okay.
all questions.
Amazing. Thank you for that. I will link all that in the show notes. So if someone's driving, don't worry. You can find the show notes later and reach out to Alex. That's great. And maybe it's time for potentially for if somebody listened to this conversation and is like, you know what, I have been avoiding that certain movement. Maybe it's time to come in and see what that's about, or if you just want to live a long healthy life and stay active, or take your pickleball game to the next level, you know, maybe you come in and see Alex and get an assessment and just see, hey, where am I maybe not moving the way I was or intended to be, because like Alex said, your body is craving tell us again, your body is craving
Movement stimulus, yeah.
movement stimulus. Yes, I love it. Remember that. You know, we think we're only craving the bad things. We're actually, our body really is craving the good things too.
Oh yeah, yeah,
Yeah, I
yeah.
love it.
I
Yeah.
haven't met someone that's starting to work out consistently and they're in a bad mood, right?
Oh,
It's
that's such a good point.
yeah, it's usually the good feels start to come in pretty quick after a
Yes.
consistent
Yes.
exercise movement program. So
Yeah, I think I saw a meme. It was something like, I really regret that workout, said no one ever. You know, like it always feels better on the other side. Yeah. And that goes for walks or any of it, you know, just
hmm
whatever you do. So thank you. This has been inspirational. And you know, if anyone listening this is really like landed, or you know someone in your life that this conversation could impact in a positive way, please share this message so that Alex can do what he was put on this earth to do and help keep you healthy and active well into the future. Thank you for joining us for this podcast, Alex. It's been a pleasure.
Thank you, Dr. Emily, and thank you for your work. Like I said, I'm very inspired and motivated by the functional medicine world. So, like, all your work is incredible, and I will never not continue learning from what you're doing. So, I
Oh,
really
thank you.
appreciate it. Yeah.
Perfect. Thanks so much.